This rainbow from full agonists, guess what? Your native neurotransmitters are always full agonists. Some drugs are full agonists, but they often, even they try to be full agonists, they don't quite get there. So they're still called partial agonists, but they're way over there on the left-hand side, almost agonists. And so the neurotransmitters themselves and the 5-HT1As that we use in practice embedded in the pharmacology of the atypical antipsychotics are almost agonists at 5-HT1A. There are some partial agonists that are D2 for Parkinson's disease, restless legs, pramipexole, ropinirole, and these sorts. They're D2, D3 agonists, but they're not quite full agonists. But then what we're more interested in the spectrum is the partial agonists that are almost antagonists. So most of our drugs are D2 antagonists, and some of them are almost full antagonists, and those are the ones that we talk about for schizophrenia and bipolar mania, and now increasingly augmentation and depression. There's even a thing called an inverse agonist, which is not clear what that means clinically, because drugs in certain types of assays will look like they're inverse agonists, but they actually are not clinically different to a clinician than an antagonist. So I don't really talk much about it. But right now, let's just talk about the part of the spectrum on the left, which is clinically relevant. So 5-HT1A, almost full, but yet partial agonism, same kinds of pathways, but all of a sudden I've got a 5-HT1A receptor a little bit located differently on that same neuron. It turns out that this is always inhibitory. Guess what? That's the brake. The other one was the accelerator. Every good neuron has an accelerator and a brake. Generally speaking, they can balance things. So if you really want to get the most out of it, what you want to do is take your foot off the brake, or take your foot off the accelerator and put your foot on the brake. And so taking your foot off the accelerator is a 5-HT2A antagonist, and putting your foot on the brake is a 5-HT1A agonist. So this is going to actually inhibit this glutamate neuron, which is not going to let glutamate come out, which is not going to make GABA come out, which is therefore going to make dopamine go up. You ever wonder why atypical antipsychotics have antidepressant effects when augmenting SSRIs? They raise dopamine in the cortex. By both the 5-HT2A I showed you 4 slides ago, antagonism, and 5-HT1A agonism, and some of the ones that do it the best have both, because you're both taking your foot off the accelerator and stepping on the brake. I know some people drive with their foot on the accelerator and the brake, don't get too far in life, but it's usually best to have those in synchrony. So you want to reduce the cognitive, negative, and affective symptoms with 5-HT1A partial agonists.